wanted to talk to you a little bit about vaginal estrogen and who you think should be on vaginal estrogen.
So that is one of the big symptoms that we didn't talk about actually of perimenopause and menopause. Especially when our testosterone levels drop and our estrogen levels are going up and down, we'll very often get pelvic symptoms. So they can be urinary symptoms like having to pee all the time and get up at night to pee. Urgency, where you sometimes, often don't make it to the toilet even. And urinary tract infections. Our microbiome really changes. Those tissues that are down around the pelvis that are normally nice and thick and healthy, they become thin and drier, and women are very prone to getting urinary tract infections. And then you'll get the vaginal dryness and vulval dryness as well. Very uncomfortable. So women who get that can be women who are undergoing breast cancer treatment, women who are going through perimenopause or menopause, women who are lactating. So if you're breastfeeding, very often your prolactin levels are high to tell your breast to produce milk, but that can often prevent you from making the hormones that you need to keep your vulva and your vagina healthy as well. So those tend to be the groups of women who suffer with that.
And vaginal estrogen, we know, is very safe. It's a very small dose. You're popping it into the area that it's needed, and patients don't need to be concerned about breast cancer risk, even though the leaflet inside the box might say that you do. We know that that's not correct. Isn't that right?
Oh, yes. That leaflet, I always say to my patients, please just throw it in the rubbish. Don't even look at it. Back after the Women's Health Initiative, they did this thing called class labeling, where, and I think a helpful way of thinking about it is having the same warning labels on a little tube of hydrocortisone that you're going to put some on your rash every day on your hand, telling somebody that you're going to have the same side effects and dangers with that as large doses of oral prednisone or steroid that you might take if you had lupus or rheumatoid arthritis or some autoimmune disease. So I think we all know logically that makes no sense. And it's the same thing with vaginal estrogen. They've studied that up the wazoo. They've checked women's labs 12 times a day while they're using vaginal estrogen, and their levels stay in a menopausal level. It just doesn't get absorbed well through the skin down there. And so it's very, very safe. And even women going under or undergoing most types of breast cancer treatment will be able to use their vaginal estrogen safely. Seemingly using your vaginal estrogen every week for a year has about the same amount of estrogen in it as 1 to 2 birth control pills.
Yeah, it's tiny dose. And it can be just life-changing. Obviously, as a GP myself, and I know you'll be the same, how many older women do you have who just constantly come in with their little pot of urine to get tested because they just are constantly having UTIs, or in fact, they're just on long-term antibiotics trying to prevent it. And you just have to think of how many would have been prevented if these women had vaginal estrogen all those years. Aoife, we've touched a little bit on testosterone. Testosterone has definitely hit the media in recent weeks, certainly in Australia anyway, but I think it's worldwide. Lots of kind of quite negative publicity saying that all these women are being given testosterone and it's way too much and not being monitored closely. I know the women I have on testosterone have very regular blood tests, and they're on an absolutely very, very small dose, and some with a very big benefit. I'd love you to talk to me a little bit about your thoughts on testosterone replacement in women.
Like we were saying earlier, testosterone is one of our really important hormones, and that is where we get our estradiol from as well. So we usually have a ton of it in our bodies, and it does start to drop during perimenopause. That can have big effects on women. It can have effects on your muscle mass. It can have effects on your brain and your bones, and sometimes even your mental health, And so, yeah, it's been in the paper a lot. The Guardian in the UK I had a couple of stories out even on the same day talking about how every woman has access to testosterone, and just, oh my goodness, so untrue. I mean, we know the number of women who have been able to find a doctor to start them on hormone treatment is so tiny. We're talking probably less than 10% in the US. And so only a small percent of them would be on testosterone. So we're probably talking 1% or 2% of menopausal women. So it's a pity that they choose to do that, because it's just putting more obstacles in women's way. I find it very helpful for some of my patients. Often when we feel like we've reached all the benefits we can reach with their estrogen and the progesterone, if they're still saying to me that they are having brain fog, word finding difficulty, concentration difficulties, kind of ADHD symptoms often, if they are going to the gym and working out and they just can't seem to build muscle, and if they're having problems with libido, we will then usually talk about testosterone and doing a trial of that. And when we do a trial of testosterone, we are aiming for normal female physiologic levels. We are not aiming for male hormone levels. And so even though testosterone is very abundant in our bodies, we still only have about a tenth of what men have. So we're aiming for normal physiologic levels. And over here, there's a big business with naturopaths and chiropractors and these providers who present themselves to patients as doctors, as medical doctors, using pellets in patients. And so they'll charge them a large fee to come in and have pellets injected into their buttock every few months. And so we see the patient then later on who's come in and they have clitoromegaly, so enlargement of the clitoris, which is usually not reversible, and sometimes deepening of their voice, a real change in their voice, which often is not reversible too. So there can be some serious side effects when it's not, I don't blame any woman for that. We've pushed them down that route because they're looking for help and their doctors don't have the answer. And so they go to someone who will help them. And often here that is someone who might be using pellets.
Yeah, so just to clarify, those symptoms are because the pellets are, much higher dose than what you would be using normally, or what you or I would be potentially prescribing to women in the form of a cream. Usually that's what I would use. Is that the same for you? Is it a cream that you would prescribe?
Absolutely. Yeah, that's those symptoms are from the very high doses from the pellets. We don't have an FDA approved product for women over here. Australia is the only country that does your androfen. We're all very jealous of that. Yeah. And so what we have to do here is we have to use the male testosterone gel and use a tenth of that comes in a little sachet or a tube, and you have to use a tenth of that. So make it last for 10 to 14 days. The sachets, once you open it, it says it's a gel, but it's like water. So you're trying to get a pea-size amount out of this sachet, and it's just all over you. Very difficult for women. And the tube, if you can get your hands on the tubes, that's better. And so often what we end up doing is going to a compounding pharmacy and asking them to compound it for us in a cream, which is easier for most women, but it's expensive.
And Aoife, one group of people that we haven't talked about today is those lovely women who are very, very lucky and sail through the perimenopause and get to the postmenopause and don't potentially feel like they've got any symptoms, but who are hearing all of this noise around perimenopause and menopause and are really interested to know what are the health benefits potentially for them of having hormone replacement therapy, even if they've kind of sailed through, as it were, and not noticed too much in terms of symptoms. What do we know about those kind of patients?
So even from the Women's Health Initiative study, we know very clearly that if you start hormone treatment within 10 years of your last period, you can decrease your risk of cardiovascular disease, so that's heart attack and stroke, by somewhere between 30 and 50%. You can decrease your risk of developing diabetes, colon cancer, osteopenia and osteoporosis, genitourinary syndrome of menopause, which includes those bladder symptoms and urinary tract infections, and vulval and vaginal symptoms. And there's a neuroscientist called Dr. Lisa Mosconi over in New York who's doing research into women's brains going through menopause. And her research is really looking like it can help prevent dementia too. So such important benefits. You know, back in the late 1800s and early 1900s, we would die in our 50s, you know, from a dental abscess or a pneumonia or the flu. And so you might have menopause symptoms for a few years and then, you know, you die. But now, because of modern medicine, we are living up into our 80s and 90s, and some women are living a third to half of their lives with no hormones, which most of our bodies don't tend to like. So you do see those women who fly through menopause. And I think, you know, no pressure to ever start any hormone treatment at all. But I do think that every woman needs this information. So if your doctor tells you you don't have any symptoms, but here's what the research shows, 30 to 50% decreased risk of cardiovascular disease, et cetera, and you say, that's great, I love knowing all that, thank you, it's not for me. Perfect. That's all you want as somebody's doctor. Give that woman good information and she can make good medical decisions.
Yeah, absolutely. I agree 100%. Eva, one of the other groups that I see a lot are women who are really struggling to control their weight. So how they've eaten before, how they've managed their weight or lost a little bit of weight when they needed to, doesn't work anymore. The way they exercised previously just doesn't seem to be working for them. Do we have an understanding of why that shifts and changes so much and why it is so hard for women to control their weight through the perimenopause and postmenopause?
So those hormonal changes in us have massive metabolic changes or effects. Well, first of all, you know, if you're having any sleep difficulty, whether it be from your progesterone dropping or your estrogen dropping and you're having night sweats and hot flashes and your sleep is broken, breaking anyone's sleep like that really has a detrimental effect on their metabolic syndrome. Your cortisol level is just high all the time. Cortisol and insulin are best buddies. They like to travel together. And so often you'll end up with insulin resistance as well, which is a setup then for diabetes down the road. We know that estrogen is connected to, you know, your cholesterol production in the liver. And so that tends to go a little haywire when your estrogen levels drop too. Your HDL, which is usually beneficial, tends to drop, and your LDL, which is the one we keep our eye on, tends to increase. And so I'll often see a woman, you know, and 2 years ago, her blood work was completely normal. And now I repeat it, and her glucose has gone up, her cholesterol has gone up, her blood pressure has gone up. And these are all from our hormones changing throughout menopause. And then it has an effect on where we deposit our fat. So like we said earlier, usually women will deposit it around our hips and our thighs and maybe arms. And then as our female hormones start to drop, we start to deposit that fat around our middle, which is much more dangerous because it can infiltrate our liver. It surrounds our kidneys, and we call that visceral fat. You don't want visceral fat. Puts you at risk of cardiovascular disease. So all those things together, a woman cannot make any changes to her diet, her exercise. She can be just an angel, and still she will have those metabolic changes. completely out of our control.
And so do the hormones help?
Yeah, I mean, I would love to say that once I start a woman on hormone treatment, the weight comes off. But what I find happens is that her mood improves, and she's sleeping better. So now she has energy and cares about what she's eating, and feels more positive about things. And also, all of this education with our patients includes dietary education too, right? So we're talking about gut health, our microbiome, how important fiber is, and how important protein is. And that testosterone and estrogen dropping, that has a big effect on our muscle mass as well. And the more muscle we have, the more insulin we burn, or the more glucose we burn. Sorry, the more cholesterol we need to make those cell membranes. And so once we start to lose our muscle, then that really has that big metabolic effect too. So I don't find that starting hormones makes, one of the kind of side effects of it is not weight loss, but it helps a woman feel back to herself, and in a place where she can actually get back to her exercise. And
when I started this podcast back in December 23, I knew that I was lucky enough to have amazing conversations with various health professionals across all facets of medicine and allied health. And I knew that you would probably really enjoy being a fly on the wall to hear what we talked about. And that's how the podcast was born. And what you probably don't know is that this is a bit of a passion project. We don't have any sponsors or funding. And without your help, we won't be able to continue bringing you these great guests. So if you can please spread the word about the podcast, share it with someone who you think might benefit from the conversation that you've just listened to, or if you can leave us a review or a comment, it would mean the absolute world, because that actually helps the podcast spread further and get more people to hear our message, and hopefully allow us to invite bigger and bigger guests onto the show. And I would so appreciate you helping me back. Thank you. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.